This video is brought to you by the Wisconsin State Health Insurance Assistance Program, or SHIP, a local public service for people with Medicare. Since all Medicare Part D and Medicare Advantage plans can change their costs and other details each year, it's important to review your plan and compare it to other plans available to make sure you will have coverage that meets your needs in the new year. In this video, you will learn how to use Medicare's plan comparison tool known as the Plan Finder. This presentation is supported by the Administration for Community Living. The first step is to type Medicare.gov into your web browser, which will take you to the Medicare homepage. The homepage should look similar to what you see on this slide, although the pictures and buttons may be updated frequently. To access the Plan Finder, find and click the button that says Find Plans Now. To continue, you will need a list of your prescription drugs, drug dosage, quantity, and refill frequency. If you do not have an online Medicare account, you might want to sign up for one now. We have another video explaining on how to create a Medicare account, and the link will be in the description below. If you have an online Medicare account and you are already enrolled, your prescription drugs will show up in the Plan Finder. You will be able to edit your drug list once you log in. If your current plan is available next year, you can also see the changes and how it compares to other plans. If you do not have an online account, you can continue without logging in. Choose the year you need coverage, if prompted. Enter your zip code. If multiple counties appear, click on the correct county in which you live. Then click Continue. You will then choose either Medicare Advantage Plan Part C or Medicare Drug Plan Part D. Click Find Plans. You will be asked if you get help with your Medicare health or drug costs. If you have Medicaid in Wisconsin, you will have a white Forward Health card. If you get help with the Medicare Savings Program, it means the state is helping pay some of your Medicare costs. If you get help by the Extra Help program, it means you have lower cost Part D drug coverage. If you are not sure or have a question, call 1-800-MEDICARE. You will have the option to click, do you want to see drug costs when you compare plans? Now you will have the option to enter in your prescription drugs. When entering your prescription drug, make sure you click on it in the drop-down list. Click Add Drug. If you take a different dosage than what is shown, you can click the drop-down arrow to choose your dosage, and depending on how much you take per day and how often you refill your prescription, you can adjust the quantity here. You can also change how often you refill your prescription by clicking the drop-down arrow. After you enter the correct information, click Add to my drug list. Once you add your prescription, this is what it will look like. You can now add another drug. You will repeat these steps until you have entered all of your prescriptions. Once you have added all of your prescriptions, click Done Adding Drugs. You can now choose up to 5 pharmacies to compare. Check the box for mail order and any local pharmacies you use and other pharmacies you might use. The pharmacies you choose will be listed at the bottom in the blue box. Click Continue to view plans when ready. You can now narrow your search to include healthcare providers. It will show you a list of plan options for prescription drug plans. You can filter by insurance carriers, star ratings, or view all filters. If you would like to switch plan type, click here, and you can switch to Medicare Advantage Plan Part C without starting over. click Find Plans. It will now show you a list of Medicare Advantage plan options. You can filter by health plan type. You may find that some providers, including hospitals, may be in the network for some plan types, but not for others. You can click the information icon for more information. You can filter by plan benefits, insurance carriers, drug coverage. Most Medicare Advantage plans include prescription drug coverage. Make sure to double check. You can also filter by their star rating or view all filters at the same time. You can compare up to 3 options side by side. Your options will be sorted by the lowest drug and premium cost, although there are other options. So looking at this plan, you will see a health deductible listed and a drug deductible listed. The drug deductible is the amount you pay for drugs before your plan starts to pay any drug costs. In this case, the total drug and premium cost for the rest of 2026 is $530.96, which includes the $250 drug deductible. Medicare website calculated the estimated cost for the year based on the prescription drugs we entered earlier. If you are logged in, you can enroll right here with the Enroll button. You can also call the health plan directly or call 1-800-MEDICARE. Make sure you have this plan ID with you when you call. For additional assistance, you can call 1-800-MEDICARE. You can contact the Wisconsin Medigap helpline either by phone or by email, or you can go to www.dhs.wi.gov/Medicare-help.